right now, I'm going to take you through a series of movements and exercises that will help provide fast relief for any sciatica issues. Okay, we're going to start off with a couple exercises that are going to be to warm up, get blood flowing, nutrients and oxygen to the area, and then move on to some specific exercises that will help the nerve break free of any scar tissue or anything that's impinging on your sciatica nerve. Okay? So, what we're going to do now is what's called the cat-camel. And we're going to start just by moving the lower back. Right? And this is called pelvic tilting. So we're going from anterior pelvic tilt to posterior pelvic tilt. And this is just allowing us to move the joints, the vertebrae, and just get blood flow and oxygen. And just doing the moving actually helps with getting nutrients to that area. Right, so now, after we've done a few of those, we're going to start to move to the mid-back. Okay, you're going to start to see the mid-back push up a little bit more, and this is actually a beautiful stretch for the whole spine. You'll see once we start to get to the end of this. And remember, consistent breathing is very important. We get more oxygen in. So now we're going to move up a little bit further up the spine. And we're going to start to hold it at the top. And then tuck the chin. And then start to see my whole spine getting a good stretch here. Exhale at the top and really push down with your arms to reach up. Think about your mid-back and spine trying to reach the ceiling. We're going to hold it here. Okay, now we're going to go down deep and all the way up extended. And we're going to do one more rep. So back down. Last one. All right. So that movement would have gotten your whole spine. And now we're going to get to another important aspect for mobility. We just mobilized the spine. Now we want to mobilize the hips. So if you've done the back program before, back pain relief for life, you've probably done the single frog leg, right? So make sure you're using your elbows to take stress off the lower back. And the single frog leg is going to be pulling the knee into the chest, circling out to the side, and then moving forward. Very slight, easy movements because we're not fully warmed up now, so we're just going to ease into it. As we begin to feel the hip mobilize, we're going to go a little bit bigger circles, and we're going to pull the knee back just a little bit further. And again, focus on your breathing. Notice how I'm keeping my foot close to the inner thigh. I'm not kicking out. So I'm keeping it close to the inner thigh, and I'm pushing out a little bit further each time. You might feel stretching on the inner thigh. Feel your glute activating, and keep your abs nice and tight. All right, let's do a couple more. Good, and switch. If you hear some cracking and popping, that's okay. That's more scar tissue, and the joints are just finding some more room. And we're lubricating the hips. And remember, the hips are directly connected with lower back pain. What happens is the hips become stable when they're supposed to be mobile, and the lower back becomes mobile when it's supposed to be stable. So we're mobilizing the hips and then keeping the abs tight and stabilizing the spine. So let's do a couple more. And this is just creating more mobility and stability so that we can get better results for the next 2 exercises. All right, so we're gonna roll onto the elbow, making sure we get up properly so that we keep our back straight. You should feel loosened up in the hips and the spine. Just from those 2 exercises, you should start to feel great. Now we're gonna move on to a specific exercise. All you need is a chair for this one. And this is called flossing. Your nerve, if you have specifically sciatica, is impinged. And so we want the nerve to break free from that impingement. And so the nerve can slide up and down. And if we do it enough times in the proper way, it'll break free of any scar tissue or any impingement. The key to this, or the caveat to that, is while you're doing it, you might feel more pain. But you should feel relief afterwards. So we're going to do 5 reps on the affected side. So let's say if it was on your left leg. We're going to sit up, posture nice and straight. You're going to extend your left leg out. And then you're going to look up. And then you're going to repeat. Extend the left leg out, make sure the toe is pointing at the ceiling. You should start to feel this. Tilt the head back. We're going to do 3 more reps. Again, continue to breathe. Last one. Okay. Now we're going to do the same thing, but tilting the head down. So the opposite side, we're going to floss. So up. Repeat. Bring your foot up. Three more. Tuck the chin all the way down. 2 more. Last one, still keeping the posture good. Tucking the chin all the way down and relax. While you did that, if you have sciatica, you might have felt more pain. Keep in mind, we're breaking free from that scar tissue so that you're going to feel better later on. The next thing we're going to do, the final activity or movement, you're going to put your feet against a wall. I'm going to use this as a demo. All right, so feet flat against the wall. If you can't even sit in this position, you're going to keep your hands behind you and gently walk forward. So this is option 1. Option 1 is here, and then tuck your chin and try to crawl a little bit more forward each time. And now push your forehead down and hold it there for about 10 to 15 seconds and relax. And now we're going to do option 2. Option 2 is hands behind the head, tucking the chin in and moving from your lower back forward. Take deep breaths in. And keep in mind, you're keeping your hands behind your head, pulling your chin down. And breathe. And hold that for about 10 to 15 seconds. You might feel that all the way down your leg. I don't have sciatica right now, but I still feel a deep stretch, and I can actually feel the sciatic nerve engaged in that process. So, if you have an impingement, again, you might feel pain, but we're looking for relief later on. Remember, if this was your nerve and you had an impingement, while we do this, it's going to be moving on the thing that's impinged, so it can cause a little discomfort or more pain, and typically, the healing process is that it will get worse before it gets better. I'll tell you a quick story before we end here. We've had numerous clients that have come in here with sciatica, and we've gone through the program, and we always have to reassure them that the pain can intensify before they get better. One in particular was increasing pain throughout the month of training him, but he had some blips of hope and relief, and we continued with the program, and after about 3 to 4 weeks, he no longer had any sciatica pain, which he had for nagging pain for over 10 years. So keep that in mind. We're doing short-term, more intense pain, possibly, not always the case, for long-term relief so your nerve can be broken free from any impingement and any direct root cause of pain. All right, this is Ian Hart. I hope you enjoyed, and I sincerely hope that you are free from sciatica after continuing with the Relief for Life program.